Patient I'll be reviewing today is a 64-year-old married African-American male that presents to the office for Suboxone induction and to begin treatment in the IOP program. Patient states that he's been prescribed Percocet for chronic back pain for the issues for the last few years, and his prescriber was no longer going to prescribe him this medication. Patient's last dose of Percocet was approximately 48 hours ago. Patient states that he's been misusing this medication for the last 6 months, as evidenced by taking more than prescribed, then seeking and obtaining more of this medication and or Suboxone from friends and family when he starts to feel withdrawal symptoms. Patient was made aware that once this therapy starts, that he cannot take the Percocet anymore. Patient brought his remaining supply of Percocet to the office for disposal and was escorted to the pharmacy at UTMC to do so. Patient is receptive to treatment and expresses desire for a change in behavior. Patient is currently not active in therapy, but will start group therapy today and get a referral for one-to-one counseling. Patient states that he's having difficulty concentrating, rates both his anxiety and depression as a 6 out of 10, which is consistent with his outward presentation. Patient states that he has also had a recent increase in irritability since discontinuing the Percocet. In regard to his cognition, he exhibits mild paranoia related to some distrust with healthcare providers. In regard to lifestyle habits, he is retired and his typical day does not have a whole lot of structure to it. He also doesn't get a whole lot of exercise, but states that he's eating and drinking well, and that he normally sleeps pretty well, but has had some trouble with that since discontinuing the Percocet. Patient has a current heart rate of 91 beats per minute, is noticeably diaphoretic, restless, and has mild diffuse discomfort. He has a runny nose, mild nausea, and mild anxiety also. Patient has a COWS score of 13, which is above the protocol threshold of 8 to induce Suboxone therapy. For his mental status exam, he's well-groomed and makes fair eye contact. He's cooperative, conversant, and motivated to change. He also exhibits some minor psychomotor agitation, as evidenced by some fidgeting in the office. He has a steady gait, states that his mood is anxious, his thought process is linear and goal-directed. His thought content is normal. He's alert and oriented times 4. His insight and judgment are limited. And we talked about his cognition earlier. His medical history includes both chronic lower back pain and chronic neck pain, along with hyperlipidemia, BPH, uncomplicated opioid dependence, and opioid withdrawal. His urine toxicity came back negative for all illicit drugs, and all other pertinent labs were unremarkable. Patient is currently experiencing moderate opioid withdrawal, as evidenced by a COWS score of 13, and for that we're going to induce Suboxone therapy at this appointment and monitor for adverse reactions during the IOP group therapy. We're also going to prescribe Zofran 4 milligrams Q6 PRN for nausea, clonidine 0.1 milligrams TID PRN for chills and diaphoresis, and dicyclamine 20 milligrams TID PRN for stomach cramps. We're going to continue education and counseling in the IOP treatment program and follow up tomorrow for updates on progress for the withdrawal symptoms that he's feeling. That's about it for today. Thanks.